Blood sample can be used as one of samples to detect COVID-19 in patient. ELISA method is used to detect it. Blood is taken from outside of the elbow or wrist and fingers. Immunoglobulins IgG, IgM are detected during ELISA reaction. So materials needed to collect blood sample: 5 ml sterile vacuum tube with cold activator, sterile syringe, a sterile tray, sterile tweezers, sterile balls, 70% alcohol, tourniquet. About the procedure, first of all, we have to explain to the patient the purpose and the course of manipulation, and we have to put numbers to the tube following laboratory rules. And we have to help patient get into a comfortable position. Treat your hand with antiseptic and place on oil-cloth roller under the patient's elbow. Apply a tourniquet in the middle third of the shoulder. Make the patient to clench a fist. Treat the injection site with alcohol. Take the needle by the colored cap and screw and remove the white cap. And palpate the vein, determine the site of venipuncture. Fix the vein with the left thumb and insert the needle into the vein. Take the holder and take test tube in your right hand and insert it with the cap into the holder. Loosen the tourniquet. After filling the tube, the required volume, remove it from the holder. Gently mix the contents of filled tube by inverting the required number of times. Take off gloves, wash your hands, use syringe and gloves in a safe disposable box. Taking blood sample is studied in the laboratory for the presence of COVID-19. So main differences between PCR test and the ELISA test. Polymerase chain reaction test is performed to detect genetic material of COVID-19. The test detects the presence of virus if you are infected at the time of the test. The test could also detect fragments of virus even after you are no longer infected. And the PCR test for COVID-19, also called like a gold standard test for diagnosing COVID-19 because it's mostly used in the laboratory. The third step is PCR step, which uses special chemical and a PCR machine called a thermal cycler, which causes the reaction to occur that makes millions of copies of small portion of COVID-19 virus's genetic material. During this process, one of the chemicals produces fluorescent light if COVID-19 is present in the sample. This fluorescent light is a signal that is detected by the PCR machine, and special software is used to interpret the signal as a positive test result. You should receive the results of your test as early as 24 hours after sample collection. The main advantage of COVID-19 PCR test is its accuracy and reliability. It's the most accurate test available for COVID-19 detection. And the second one is ELISA test, which is one of the most sensitive methods for detecting antibodies. It differs by greater availability for conventional diagnostic laboratories. Express testing for COVID-19 is performed by immunochromatography based on the principles of enzyme-linked immunosorbent assay, in other words, ELISA, with the determination of IgG and IgM antibodies to COVID-19. The material for the detection of antibodies is capillary blood sample. About work description, sampling of biomaterial is carried out by a trained medical worker using medical masks, caps, disposable gloves, face protection screen or glasses, clean disposable white coats, instruments for blood collection and testing. First of all, express test, which includes a disposable sterile pipette for capillary blood collection and a buffer solution, alcohol wipes, disposable scarifier. Performing the express diagnostic procedure, take a blood sample from your fingertip, add 10 microliter sample into the well, Dilute blood with 3 drops of buffer solution. The result is ready in 10 minutes. After 15 minutes, person performing test reads the result. Positive IgM means acute period of infection. Positive IgG means past disease. Positive IgM and IgG transition from the acute stage to the stage of the transferred infection.